Hello, good evening, good afternoon, good morning and welcome. My name's Nurse Richard the Wax Wizard. Thanks for joining me. Interesting 2 ears this. I've had quite a few weird and wonderful and interesting cases recently, and this is certainly one of them. This chap came to see me and I don't think he'd had this done for a number of years, maybe somewhere between 5 and 10 years ago, but he had it done in the past. And he had a sensation of it was itchy, it was blocked, his hearing wasn't great, he wasn't in any pain as such, but just said it felt uncomfortable. And I wasn't really sure at first if there was anything unusual or different about these 2 ears. It just looked like there was a fair old collection of dead skin in this. You can certainly see this when I start pulling it from the side there. There you go, can you just see the whitish material on the side there? Now that's just dead skin. It's dead skin. Skin sheds in the ear, like it sheds everywhere. But normally, I know I've said this before, normally when it sheds all over your body, it flakes off, washes off, comes off in the shower. But when your ear, the body designed it to move sideways to expel it out the ear. If it didn't, then we'd all have ears full of dead skin, which is what this chap had here. Now I don't think it's keratosis obstrucans per se. But there was something unusual in both ears after I cleaned them out, which again I'm not 100% sure what it is. I have some suspicions, but as you'll see as the video, I mean the clue's in the title, to be honest with you, so there is a spoiler there. And as I've said on other videos before, it's not my job to diagnose these things. That's for the specialists, that's for the ENT, doctors, consultants, specialists, and what have you. It's my job to discover these things a lot of the time. And sure, I can point people in the right direction as to what I think it might be, but ultimately it's their job to diagnose what these problems are. And it can be one of 2 things, I think, because alright, there's a spoiler alert, there's exposed bone. Certainly in the other one, possibly in this one. A bit harder to tell in this one, and you'll be able to see why in a minute. Now, reasons why you can get exposed bone in the ear canal, there's a couple. Benign osteitis is a condition where there's reduced blood flow to the ear. Basically, if your skin, your bone, it's not receiving enough blood flow, it's not receiving enough oxygen, therefore that tissue can die. The bone can literally crumble away. As you can see, put a bit of olive oil in this because it was just getting really stuck. This bit, I just couldn't get it out without it. The skin and the bone could just die and crumble, flake away. And that's benign osteitis. The other one, it's quite rare, you can get ear canal cholesteatomas. The cholesteatomas more than often develop in the eardrum behind and invade the middle ear space. And you can get a collection of dead skin, sometimes get infected, it's in a pocket. You'll all know this, a lot of you regulars. But you can get a pocket when the eardrum's sucked in, it can create a little pocket, and then this dead skin can get trapped in there, get infected, invade the middle ear space, damage the bones of hearing, etc. To get one in the ear canal is quite rare, not unheard of, but quite rare. And if that's what this is, then obviously it needs looking at urgently. Whatever it is, it needs looking at urgently. So as soon as we find things like this, I obviously contact the patient's doctor, the GP, general practitioner, send them images, videos and a letter along with a description of what I think's going on, and can you please refer this gentleman urgently so they can get this looked into. And you can already see, can't you, as I've managed to pull that bit from the side, there's a load of soggy, mushy, dead skin to the side of that. This was a substantial chunk as well when this one comes out, a lot bigger than I thought it was going to be. When I pulled it out, it just put up a right good battle before I could pull it out. But I think we're not far from pulling this out. And then there's quite a fair bit of peeling involved after this. Now I have got an image. I don't always find time, or to be truth be told, be bothered to take pictures of these things and put them at the end of the video, but I've done that with this one because it was quite a large, interesting plug of mostly dead and soggy skin. As you'll see when it comes out, have a look at the size of this. You see it's just enveloped in all this dead, soggy, white, mushy skin. And yeah, you can see what it's left behind. I've gone down to the fine end tube here. Now, we don't manage to get every little speck of this. I'd have been literally there all day trying to get every little speck. But I was certainly happy by the end of it with how much we actually did get. And just a bit of oil getting in front of the screen there, just blurring it a little bit. But what I wasn't so sure about in this one was the shape of the ear canal. Already doesn't look quite right, does it? There's a few peaks and troughs and dips and crevices, as you can see there. So what I'm trying to do is peel away all this dead skin and debris, and hopefully we can reveal what's going on. It's clearer in the other ear, what we found in there. This one, now, has it been widened at some point because of all the dead skin collecting in it? It's got infections, possibly. Now, bits of it may well have widened, and then the skin may have healed over it. That could have happened too. And if there's any more specialists that are watching this, hello to you, thanks for watching. If you have any ideas at the end of the video as to what you think is possibly going on, then let me know in the comments down below. And thanks for all your comments recently, I do appreciate it. I know I do read every single one. I can't reply to all of them. I'll try my best. But there have been a lot, specifically lately. I think a couple of the videos went a bit bananas. I think there was one about keratosubtrans that went a bit. The views went through the roof. So I might have found a few new subscribers and followers following that. So hello to you guys. Feel free to catch up on everything you've missed. We've got about a year's worth to catch up on, so crack on. Now, this was as you can see, fine and tube this is difficult stuff, this, because again, until you grab this, you're not entirely sure how close to the skin of the ear canal you are. So peeling this kind of stuff, it's not easy, especially when it's as soggy and as mushy as it is. And you can see when we've peeled that bit from there. So some of it's forward peeling, some of it's backwards peeling. Now, you probably think, oh, what do you mean by that? Literally when you grab an edge and you can literally retract the suction tube so it peels backwards. Sometimes it comes out better that way, and sometimes you grab the edge and then you slowly move it nearer and nearer towards the eardrum and it peels that way. And there's a bit of both of that going on here. So as you can see under there is something, there's a backwards peel. So there is some pink there, but I don't know, there does seem to be, it's quite thin, this skin for me, so there might well be, if not very close to exposed bone, than actual exposed bone. But you can see here, can't you? Bit of a trench. You know, it's like a U-shaped trench in this. So has this been exposed at an earlier point and then managed to close over a little bit, possibly? Again, not entirely sure, but you wouldn't say it was a conventional shaped ear canal. And again, all these little soggy, mushy bits sometimes can be a bit of a giveaway that there's been stuff collecting in there. It's got a little bit infected underneath it. So again, you can see it's a bit whiter, that bit that I've just taken from that side there, can't you? So working a bit closer towards the eardrum now, so being very careful, very cautious, as we are everywhere, but definitely more so here. This is as you'll know, this is the bony part of the ear. Like I said, don't get every single speck of this. It's certainly, I mean, when that big chunk came out, not that long ago, I mean, that restored his hearing almost immediately. So as far as relieving his symptoms that he came in with, that was it, job done, you know. but I wanted to peel away as much as I possibly could, as much as I safely could anyway. So when the specialists have a look at it, they've kind of got a blank canvas to look at, you know. Now, I can see when I'm kind of hesitating here, because I'm kind of thinking, shall I have a go at that bit on the eardrum there? And I'll just see if that bit peels from the bottom there, so it might well come off with it as part of a bigger peel. It didn't. And again, this, obviously very delicate stuff, but in the suction tube this close to, if not just on the eardrum. And bits of it did want to come away. There's also what looks like a loose hair down there that's attracted a bit of stuff around it. But you've got to weigh up the pros and cons and the risk versus the benefit, you know. As you can see, I'm touching it, and yeah, bits of it do lift up and disappear up, but it's pretty stuck to the eardrum, that. So you don't want to persevere too long, you know. It'd be nice if it came away, but it's not essential that it does, you know. But I'm more than happy that we've possibly exposed the problem in this one. But like I said before, the bigger problem you can see in the next one here. I'm getting a close look again. So yeah, it does look a little bit messy. Certainly better than it was when he first came to see me. But this is the one that was a bigger problem, which I was more concerned about. Not that I wasn't concerned about the first one, because there was possibly some either very thin skin or some very exposed bone. Now you can see that white soggy stuff there, just at the base of the ear canal there. I'm going to come back to that, because I'm going to get these the darker bits from deeper down first, because I already have my suspicions what's going on there, as do probably you if you've watched a few of these videos before. Speaking of a few of these videos, I've been umming and ahhing as to people ask me how frequently do I post. As often as I can. I have been known to do it every day for like a week at a time, but it's not sustainable. It'll take quite a lot of time. So for now, I'm going to do it every other day. Right, have a look here what happens when I just put the suction tube over this. Right, now can you see the problem? There's a huge crater, and when I say huge, that is a big crater at the base of the ear canal there. So that was a full-size tube there. I wasn't going to go sticking that in there, absolutely not. So let's go and get the fine end, and let's just see if we can get a bit of this other soggy stuff away. It's quite clear what you can see after you take this away. There you go. Excuse me. Hardened keratin. You can see quite clearly in that pocket there, as well as some patches of exposed bone, which you can see to the side of it, just above it as well. Yeah, it would be great if we could get some of this away, but this is really hard stuff. It's really hard. And if it doesn't want to come away quickly, then it's probably not the right thing to do to stay in there too long, because at some point you have to say, hang on a minute, we'll better leave this for the specialist, because if you hang around in there too long, pull away a bit that's maybe too big, you know, you can reveal something that you might not necessarily want to reveal unless they're in a clinical surgical setting, if that makes sense. But if there was any loose bits, then I was happy to try and get them, but some of those bits I suspect are probably crumbly bone, and if you take those away, then who knows what you can find. And yeah, there is still soggy bits at the base of that, but as far as I'm concerned here, what we've done is we've exposed the problem here. We've found a problem here. As you can see there, the dead keratin, a lot of soggy, mushy skin under that. I was not going to maul it. There's the plug. That was from the first year. That wasn't going to maul around in there too long, because, like I said, it's my job to find these things, not diagnose them, and work out what the treatment's going to be. That's for the specialists. But if we hadn't have hoovered up that little white soggy bit, we wouldn't have exposed that bit. So I was more than happy that we'd found a problem, which I obviously explained to him, and hopefully I will keep you posted on any potential treatment and to see what's going on. They may well decide to do a scan to see how far that keratin plug has probably been burying down. He had no symptoms, by the way, no pain at all. He just couldn't hear terribly well. But thanks for watching. I hope you enjoyed that, found it interesting. But for now, take care of yourselves, and I'll see you later. Bye-bye.